Good evening. My name is Sam, and we're currently going to be learning about the adolescent disease rates. So, a little bit of background on me. My name is Sam Mason. I'm currently located in the sunshiny Phoenix, Arizona. Background of me is I spent 7 years active duty Army focusing on healthcare, specifically orthopedics, and my goal, or my degree, is to get a public health bachelor's degree and then hopefully go on and get a master's in epidemiology. So, my big research question that I got at the beginning of this class was what is known about adolescent disease rates in rural countries? The reason why this piqued my interest is because I was sent down to Haiti in 2016, about 2 weeks after Hurricane Matthew had gone through, and I kind of helped with recovery and rebuilding some of the homes and neighborhoods down there for about a month and a half. So who is affected the most? So that's a good question. So the big key that's affected the most is adolescents in rural countries. They suffer from many different things like lower respiratory illness, they have a low quality of health, a lot of their social determinants of health is impacted, some are diagnosed with a psychiatric disorder, many kids are diagnosed with STIs and sexually transmitted illnesses and diseases. And then there's also the diagnosis of obesity, and then on the other end, malnutrition as well. So, one of the things that we are focused on is that many of these diseases are preventable with proper nutrition, care, vaccines, and some of them can even be cured, but this isn't going on. There's a lot of health issues and health risks down in these countries. So many of these countries include things like Ghana, Afghanistan, Sudan, and even the United States, even though we don't think that, the United States is having these issues. So, despite being in different locations in different areas of the world, many of these countries do have very similar problems, such as, the lower respiratory illness, psychiatric disorders, obesity and malnutrition, and stuff of those sorts. And the reason why is what we're going to be discussing. So, many of these policies and legislations can help regarding the adolescent health, a cheaper prevention for vaccines and more of a vaccine push, and also the low quality of health can easily be solved with the reallocation of funds. So many of these organizations such as the WHO and the CDC, they are helping rewrite many of these policies and legislations that can help these pushes. The CDC is actually doing a vaccine push in a few other countries right now, with Ghana and Sudan being two of them, to where they're pushing out these vaccines that us in the United States have had for many years, but we've never, they've never got them in many of these other countries because of the cost of these vaccines are being so high. So one of the things that we can help is that even though many of these illnesses are preventable. It has to be pushed from the top. And many of these legislatures and policies that are already written, they can be rewritten. So one of the things, the biggest thing that we can take away is that even though adolescent health is very vital and needs to be helped, a lot of these adolescents are in situations where they don't have any control and they kind of just have to deal with it and work through it, especially with the malnutrition and the obesity kind of being together in that sorts. When I, how we can use this is that we can help that push for the vaccine. So during this whole process, I truly learned more about scholarly sources and how to use those sources to provide an impact with the paper and to provide true proof. One of the things I can do to become better and what I can fix kind of go hand in hand. I can take the time and spend more time on this on papers and writing and doing the research and stuff like that instead of just trying to do the assignment in one sitting. And then one thing that worked for me was focusing on the big picture as a whole rather than one single country or, two countries. I looked at the whole what is wrong in adolescent health. So I want to thank you for taking the time and I appreciate it.